The top 6 vitamins to unclog your arteries and improve blood flow. Atherosclerosis is a condition where the inner walls of your arteries become damaged and clogged up with a stiff material called plaque. This plaque can make your arteries more narrow, which blocks the normal flow of blood. This causes poor circulation and raises the risk of heart attacks, strokes, and blood clots. So what's really happening here? Well, as you can see in this image, your heart pumps oxygen-rich blood through your arteries to keep your body alive and healthy. Now, if we zoom in, you can see the inside walls of your arteries. What happens is, these inner layers of cells get inflamed and damaged, and small cracks or lesions start to appear because of stress, a poor diet, smoking, and other causes. Now, to prevent your arteries from leaking, LDL cholesterol starts to build up around these cracks to try and patch up these pockets of damage, like a Band-Aid. You see, cholesterol is not the enemy here. It's actually trying to heal and repair the damaged tissues. Unfortunately, if you don't correct your lifestyle, your arteries can continue to get damaged, causing a buildup of plaque, which is a mixture of scar tissue called fibrin, hardened calcium, cholesterol, and other waste. These materials gel together to form a type of thick, rigid cement in your arteries that hardens like bone, clogging up your arteries and blocking the normal flow of blood. This can cause a heart attack and potentially death if the main coronary artery is blocked completely. Signs of clogged arteries. Earlier on, however, you may also experience a feeling of pressure or pain in your chest, especially if you're emotionally stressed or exercising, and the pain goes away when you relax. This pressure feeling is often caused by high blood pressure and poor circulation of blood to and from your heart. Another sign of clogged arteries is referred pain or swelling in the left side of your body, such as your left shoulder or arm. You may feel like you can't catch your breath, especially when walking, because not enough oxygen is circulating through your arteries. In some people, there are no symptoms at all, and plaque can continue to form in the arteries for decades without being noticed until a blockage occurs. If left untreated, plaque in the arteries can get thicker and thicker, greatly increasing your chances of having a heart attack, stroke, blood clot, or death, no matter your age. The 6 vitamins to unclog arteries. Vitamin K2, MK7. Vitamin K2 is one of the most important nutrients when it comes to unclogging the arteries and preventing a buildup of plaque. When your arteries are clogged, they become stiff and rigid due to hardened calcium building up inside. Vitamin K2 activates a protein MGP that prevents calcium from forming inside your blood vessels and directs it away from the arteries and into the bones where it belongs. You can take a daily supplement of 200 micrograms of vitamin K2 or consume it from foods like sauerkraut, natto, beef liver, and European cheeses. Krill oil, astaxanthin. Krill oil is one of the most powerful supplements to consider for unclogging or protecting your arteries. It contains astaxanthin, a powerful antioxidant, which helps protect your heart and arteries from inflammation and oxidative damage. You can take 1,000 to 4,000 milligrams of krill oil daily in gel capsules. Vitamin E, tocotrienols. Vitamin E is essential for protecting your heart and cardiovascular system. A deficiency in vitamin E can raise blood pressure, putting stress on the artery walls and increasing the likelihood of damage and plaque buildup. Tocotrienols, a part of the vitamin E complex, are 50 times stronger than regular tocopherols. They reduce inflammation and break down scar tissue in the arteries. You can take up to 300 milligrams of tocotrienols daily. Aged garlic extract. Allicin. Garlic contains a powerful natural sulfur called allicin, which helps lower the amount of calcium building up in arteries. Eating raw garlic daily can help control blood pressure, lower high blood sugars, and prevent arterial calcification. You can also take up to 2,400 milligrams of aged garlic extract daily. Vitamin C complex. Vitamin C strengthens the collagen in your arteries, keeping them flexible and promoting normal blood flow. It helps prevent harmful bacteria from causing inflammation in the arteries. To boost your vitamin C levels, eat foods like cabbage, sauerkraut, strawberries, and bell peppers. Avoid supplements with ascorbic acid, as they only contain 5% of the true vitamin C complex. Evening primrose oil, GLA. Evening primrose oil contains a healthy fat called GLA, which helps heal the lining of the arteries and transport arterial plaque to the liver for elimination. It's often used by women to prevent PMS and menopause symptoms, and it's an excellent all-around health booster. You can take between 3,000 to 4,000 milligrams of evening primrose oil per day. Causes of clogged arteries: eating too many refined foods, high levels of emotional stress, consuming omega-6 vegetable oils, taking poorly absorbed calcium supplements, drinking alcohol, and smoking are all contributing factors to clogged arteries. How to unclog your arteries: cut out processed foods like sugar, cereals, bread, soda, and pastries. Eat high-quality proteins like wild salmon, sardines, grass-fed beef, and European raw cheeses. Take 200 micrograms of vitamin K, 2 and 500 micrograms of vitamin D3 daily. Take long walks in nature to reduce stress and improve circulation. Avoid omega-6 vegetable oils and use healthier alternatives like extra virgin olive oil or avocado oil. Eat 2 to 3 tablespoons of nutritional yeast daily to supply B vitamins and prevent blockages. If you want to check the health of your arteries, speak to your doctor and request a CAC test. If you follow the recommendations above, you can help prevent and potentially reverse some of the damage caused by clogged arteries. Here's a summary of what you can do. Cut out processed foods. Start by eliminating sugar, cereals, breads, soda, biscuits, pastries, pasta, and sweets from your diet. These refined foods trigger inflammation in the artery walls, leading to plaque buildup. Eat high-quality proteins. Focus on nutritious sources of protein such as wild-caught salmon, sardines, grass-fed beef, organic pork, and European raw cheeses. These proteins are rich in omega-3s and other beneficial nutrients that reduce inflammation and promote heart health. Take vitamin K2 and D3. Consider taking 200 micrograms of vitamin K2, MK7, and 500 micrograms, 20,000 IUs of vitamin D3 daily. These two nutrients work together to direct calcium into your bones where it belongs, and prevent it from hardening inside your arteries. Exercise with low-stress activity. Take long, solitary walks outside for at least 1 hour per day. This helps to lower stress and increase oxygen circulation in your blood. Being in nature and breathing fresh air also lowers blood pressure and reduces the risk of heart attacks. Avoid inflammatory omega-6 oils. Eliminate omega-6 oils like margarine, soybean, canola, and corn oils from your diet. Instead, cook with heart-healthy oils like extra virgin olive oil, EVOO, or avocado oil. Incorporate omega-3 rich foods like virgin cod liver oil, wild-caught oily fish, and walnuts to help reverse inflammation and heal your artery walls. Include nutritional yeast. Start eating 2 to 3 tablespoons of nutritional yeast each day. It supplies B vitamins, particularly niacin, which dilates blood vessels and prevents blockages or blood clots. Additional tips for arterial health. Consider supplementing with whole food vitamin C sources like acerola cherry, rose hips, or camu camu if you're looking to strengthen your arteries and maintain flexible blood vessels. Minimize alcohol consumption, as it damages the liver and weakens the arterial walls. Avoid smoking or vaping, which depletes vitamin C in your body and makes your arteries less flexible. If you're concerned about your artery health, it's a good idea to consult your doctor and request a CAC test. This scan helps to assess the amount of plaque buildup in your arteries, giving you a clear picture of your heart health. Lastly, if you want to learn more about heart-healthy foods and ways to protect your cardiovascular system, there are plenty of resources that can guide you on how to adjust your diet and lifestyle to promote long-term health. Taking proactive steps now can make a significant difference in improving blood flow, preventing heart disease, and supporting overall well-being. Thank you for watching, and here's to great health, wealth, and happiness.